about drug pricing a little bit. It feels like we've been talking a lot about that over the past week. Yesterday, both you and Secretary Azar mentioned you'll be rolling out some updates to the Medicare and Medicaid drug pricing dashboards, and the Health 202 had sort of a sneak peek this morning at that. Can you share some details about what new data you're adding and why you think that will make these more useful?
Sure. So one of the things that we've talked about at the agency from the time we got there is that we want this to all be about patients first. And so much of the decision making and policy, we're always thinking about the patients. And so from my perspective, we want to empower patients with the information that they need to make the decisions that are going to work best for them and their families. So we want to empower patients with information about cost, information about quality, and also make sure that they have their health records at their disposal. So you kind of hear us talking about that, and there's a variety of initiatives around those lines. And so we've had a drug pricing dashboard that's been at the agency for a little while, but we've made some updates to this dashboard. And so in the past, what you could gather from this dashboard is you could see essentially what the Medicare program, Medicaid programs had been spending. But we've revised this dashboard, and it's available for the first time today. And this time you'll actually be able to see the prices. You can see for every drug in Medicaid and Medicare what the prices are. And you can also see for the first time the year-over-year price increases. So you'll be able to see whether there's been a double-digit increase or a triple-digit increase, or in some cases a quadruple digit increase. And so all of that information is available as of today.
Who are you aiming at with this dashboard? Who do you want to use it? I mean, just health policy folks mostly, or more of consumers? What do you?
I think it can be everybody, but essentially our philosophy has been around patients first, and we want to make sure that patients have that information. So our goal is to focus on patients, but I think it could be used by a variety of different individuals.